Hello.
Hi.
I do see Kay. She's in as an attendee if you want to see if you can promote her.
Sure. Let's see. All right. Okay, I just sent you an invite.
Hi there.
Hello.
Hey.
So, could I have gone in directly as a panelist? I, I went to the Agenda Center to find the link, and that's probably not the most efficient way, right?
So Sophia sends us like a special invite that allows us to come in as a panelist.
I should have looked for that. Hey, Sophia, while I've got you, can I ask you a question about the minutes?
Sure.
You
Yeah.
sent two copies. There were two copies on the email you sent us. Was
hmm
one updated from the other?
Yeah, it was. But the updates, it was like one small section.
Uh-huh.
So,
So I didn't compare them. It would have taken too much time, obviously. Is
yeah,
it
that's okay.
Do you think in the future when you make a change based on what one of the other board members suggests, you could highlight it so it's clear where the changes happened?
Yeah, good idea. I will do that in the future.
Okay, good. The minutes were great again. I just I don't have any suggestions at all. What was the little change that got made?
On one of the votes that wasn't unanimous, just specifying who voted which way.
I see. Okay. Hi,
Hey, Steve.
Steve. Jason, did you say something?
No, I just said hello, Steve.
I do.
Hi there. I'm just gonna run and get a glass of water. I'll be right back.
Sure. Gail, how's your computer working out? Hello, John.
Hey, how are you?
And we're all here. Too bad we can't start early. What a waste of What a waste of
3 minutes.
punctuality.
I can jump off and come back if that makes you feel better.
Yeah.
Got new glasses, Steve.
There was a mishap. These are temporary.
Okay.
I like them though. They're not too bad.
That make you look learned.
You know, we actually have solder apparatus set up here, and the attempt to repair them is about to be made in the next day or two. The pre the old ones.
Are you going to do it yourself,
Peter will do it.
Peter? Your resident optician.
Well, resident computer board repairer.
Mhm. Nice services to have in the house.
Yeah.
I don't know. Trying to solder eyeglasses together. Most solder you get is really too soft. It's hard to put together.
Yeah. Yeah. I'm prepared for that outcome.
I'm sure if you go into an optician, they would fix it for $10.
But it wasn't quite that. I've already tried and ended
Okay.
up purchasing a temporizing pair of frames.
So are we all set to go jump right out of the gate at 7
Sure.
o'clock?
Absolutely.
I guess you can't blame the mishap with your glasses on the cats.
Well, there is a new arrival.
Oh, there is?
Yeah. No,
Wonderful.
he's still in the preparatory stages before he makes his live appearance.
I see his debut.
Yeah.
Oh,
Tough shoes to fill. He
Yeah.
has.
Big shoes.
congratulations.
Yeah.
All right, it's 7. Let's begin. Um, it is April 6th, 7 o'clock PM. This is the Board of Health meeting. Let's do a roll call vote. Kay Peterson, Chair, present.
John Quackenbush, member, present.
Steve Kruskal, member present.
And other people present. Want to rattle off your names and your positions?
Sure, I'll go. Jason Belmonte, Health Director.
Gail Garza, public health nurse.
Sophia Kriegsman, Administrative Assistant.
Very good. And we're going to have guests. Have any arrived yet?
We have one attendee currently. It's Arissa from BME Strategies.
Okay. Will there be more people from BME before we begin with that section of our meeting?
That's a good question. As far as I know, we're only expecting Arissa.
Okay. Well, let's move very quickly then. We have no citizen attendees then, so we won't have a citizen comment period. Steve?
I do have something that's relevant to the citizen comment period. As it stands now, we only allow 5 minutes for citizen comment. And we allot each speaker 3 minutes. So not even two speakers can speak for a full 3 minutes. I think we should expand that citizen comment period. Not that it will ever be used to any extent, but just as in case, to 10 minutes, where 3 people could be speaking for 3 minutes each.
That seems very reasonable.
Yep.
Now that you mention it, I've wondered about that in the past. The math was a little challenging.
Yeah, and actually, you guys know what? I ripped this language off directly from the Board of Selectmen, how they set up their agenda.
Yeah.
So whatever you guys want to do, I'm happy to update it.
Okay, so I'd like to entertain a motion that we change our comment period. Steve, you want to turn it into a motion?
I motion that we expand our citizen comment period to 10 minutes, allowing 3 minutes for each speaker within that period of time.
Second.
All in favor, I.K. Peterson.
Hi, Stephen.
And I, John Quackenbush.
All right, the motion passed unanimously. Okay, so our next meeting will be May 4th, if that's good for everyone.
It's not town meeting.
It's town meeting, so
Oh,
we'll
it's
have
town meeting. It's bad for
Yep.
all of us. Okay, so what do you think about a week later then, the 11th?
So is
Okay.
that, if I'm not mistaken, is that the second town meeting night or the backup date? I know there's some conflict.
Maybe, but it rarely goes to that second day.
Yeah,
The town election is the 18th.
yeah, I'm not sure I've ever seen it go to a second day, or maybe once. Once. So I think it's probably pretty safe to assume it won't happen. Jim Repetti does everything humanly possible to keep it to one night. And if worst comes to worst, we can always schedule at the last minute something. Obviously with our 3-day posting. Okay, let's defer the minutes review until after we hear from our guest. Jason, would you like to introduce BME Strategies?
Sure. So as I mentioned a few moments ago, uh, Arissa was nice enough to spend some time with us this evening to go over community health assessment, which is something we've been discussing with our shared public health services group. Idea is to put out a survey to our townspeople, gather pertinent health information from them, and allow us to identify any potential gaps in our services. So Arissa's gonna take about 15 minutes or so to speak about that, answer any questions the group may have. So if you're able to promote her, Sophia, that would be great. And I'm sorry, Kate. So did we officially say May 11th unless something
Yes,
changes? Okay.
yeah.
Thank you for the introduction, Jason. And hi, everybody. I know that you have a lot to get to today in a short period of time, so I will be very quick. It's really nice to see you all, both old and new faces. I have a couple of slides here. I'm going to keep them in like presenter mode if that's okay with you all so I can see you. I'm happy to take questions like throughout. We don't need to wait until the end. I really appreciate you all giving me the time here today. A little bit about who I am. I'm Arissa Ruano. I'm a consultant at BME Strategies. We're a small public health consulting firm. I think we've worked with many of you here at this point, but for those of you that haven't, we do a little bit of everything: technical assistance, policy work, advocacy work. I personally and my team do a lot of community health assessments and community health improvement planning. And I think we also worked with many of the Charles River Public Health District folks in the last fiscal year doing a strategic plan. So I think some of you I recognize from there, which is lovely to see you again. Really, what we're here to chat about today is the community health assessment. I don't want to beat a dead horse, so if everybody knows what a community health assessment is, I don't need to spend tons of time on this, but I do know that sometimes in our non-public health worlds, we see a lot of folks who are kind of curious why we're talking about a community health assessment and what a community health assessment is. I know that the Charles River Public Health District identified in their strategic plan that one of the things that they wanted to do in the coming years is to think about ways to kind of gather data that represents us as a unit and not just as individual municipalities, but also as individual municipalities. And so with this community health assessment, some of the things that we're trying to do is understand where resources are most needed, what resources are being used most and being used least, and gather some data both on the individual level for the municipalities and as a group that we can hopefully use to leverage things like grant opportunities and help identify needs and kind of have some consistent data across the survey. We are using both secondary and primary data collection. We talked about this a bit with some of the folks here, like Jason, on collecting all the secondary data that currently exists in your municipalities. And then we have a survey, and we've been doing interviews and focus groups that will also kind of inform this process. I have a couple of real world examples here. I don't know that we necessarily need to discuss these, but I'm happy to. This is mostly if folks have not heard of a community health assessment before, these are some great local examples of places where folks did a community health assessment and then learned about things that would be really helpful in their community that the community was looking for that they just hadn't offered yet. And I'm happy to talk more about this, but I'm just kind of moving and grooving because I want to be able to give you all as much time back as possible. And so really, I want to spend most of the time talking about the process. And so for those of you who don't know, we've been working with the Charles River Public Health District to kind of get a survey up and running. In doing so, we used research and best practices from the federal government, the CDC, the Massachusetts Department of Public Health, and lots of other places to really gather a core survey that we thought would cover the gamut of public health issues, from environmental health to things like chronic disease and access to healthcare, while also digging a little bit deeper into some of the things that we noticed are gaps in our data. So we've covered the basics like chronic disease and do you have access to healthcare, but we also tried to dig into a couple of things that we felt like our communities were lacking in. For example, data on caregivers. That wasn't coming up very much, so we were trying to address some of those gaps there. And so we have been working with points of contact from each of the municipalities in the Charles River Public Health District, in addition to some epidemiologists on our team and Ed Needham's team, to really develop this core survey that I think you may all have seen at this point. And so we are hoping to put that survey out at the end of April. It's a rather long survey, but we're hoping to get lots of support and get lots of community feedback. And then in the midst of doing that process, we're also hosting community engagement sessions in each of the municipalities. And so one of the things that we really want to do is host these community engagement sessions to really hear from other leaders in the community. Right? We know that public health doesn't exist in a silo. And so we need to hear from folks like the Council on Aging and the food pantries and the schools and all of those things. We found a lot of success in kind of gathering everybody together and seeing what already exists and figuring out where the gaps are. I think a lot of times we'll hear like, oh, well, we don't have this. And then it turns out we do have that. We just didn't know how to connect folks to it because it was in a different sort of silo or bucket over here. And so as we're doing all of that, the survey will also be live, which I think kind of brings us to our current status. So we're hoping to send the survey out around the end of April. We're also hoping to start hosting some community engagement sessions this month in the coming weeks, and some interviews and focus groups that we might ping you all for, which really I think brings us to our sort of what we need from you and next steps. And really what I'm hoping to kind of achieve by chatting with you all here is to keep you all in the loop and all up to date on this space and what's going on, and so that we all understand what's going out and what's going on and why we're collecting this data and who we're targeting and what we're hoping to learn. But B, also candidly hoping that as the survey comes out and as we start doing these focus groups and community engagement sessions, that we can lean on you as sort of the public health experts in Dover to really help us distribute the survey and gather community support. And so I think I've said all I've needed to say. Jason, please feel free to chime in if you think I missed anything. But really what I wanted to do was talk really fast so that we can use the rest of our time to address any questions or comments that you might have for me, because I find that tends to be the best way to do this.
So I'm really curious, and thanks for doing this presentation, Rissa.
Of course.
How long is the survey? How many questions? Is it broken into general areas?
Yep,
what topics are you covering?
Yep, give me just a second. I'll actually pull it up for you here.
And can I add to John's question? Is it available to people both electronically and on paper?
Yes. So I can't answer that question while we kind of go through this. So one of the things that
Steve
we're
has
doing.
a question too. Just
Oh yeah, go ahead.
front load everything.
I would hope that we would have an opportunity to preview the questions on the survey, and also, if necessary, the ability to change some of the questions if we felt that they were inappropriate.
Absolutely. Thank you all for that. I think
And-
I can answer. Oh,
and
go
to-
ahead.
And to add something if we feel something's been left out.
Yes, absolutely. So I do have the survey here. If I do recall, I think it's just under 60 questions. We still have it in a bit of a draft form right now, and so don't quote me on that, because we have, to your point, left some space to add and remove questions. Our goal with these conversations is to make sure that these surveys are appropriate for your communities. We want to make sure that they resonate with your community, right? Like, you all know your people best. And so you know how we'll kind of feel about certain questions and what should be included and maybe even not included. This is a draft version, so when I'll say that as I share this, but I have the draft here and I'm happy to share this. And so, yeah, I think to answer your question, John, we have this kind of set up so that when users go to take the survey, which, backtracking a little bit here, we are planning on promoting this as much as possible in an e-survey. It makes the data analysis much easier. However, we have already been having conversations about certain spaces where it would be helpful to put paper copies of the survey. I know that the Council on Aging in Needham has already said that they would like paper copies of the survey there. And we're going to make sure that anybody that's looking for paper copies or that thinks that the people that they serve would use paper copies will have those. So it will be available both digitally and on paper. We do have the survey kind of starting out with what is a community health assessment? what are some frequently asked questions that we can address, and what does that look like? And I'll be clear, I can send this to you, so no need to try to memorize all of what's going on. But so we have a little bit about what the community health assessment is, what the Charles River Public Health District is, and what that kind of looks like. And then we do break the survey down into these sections. So there's an about you section, demographics. We've got a section on healthcare, a section on chronic illness, mental health, maternal and child health, food access, substance use and gambling, environmental health, transportation, caregiving, and then sort of your community questions, which are a little bit about like quality of life stuff. Did I see another hand go up?
Well, many questions would probably arise, but when I just saw a brief glance,
Yeah.
I have some concerns about HIPAA.
Okay.
Is
Yeah.
that something that you adhere to?
Yes, so we are planning. I should also mention this survey is intended to be 18 plus. So we're hoping to avoid a lot of the stuff that comes up with engaging with youth there. But yes, we're planning on keeping everything confidential and maintaining all the proper licensures. I don't have my data person here to speak to all the ways that we save and store data, but I can get that for you.
Well, I wish you would.
Yeah.
Alyssa, this will not be linked to names. Right?
No.
There'll be nothing identifying about this.
No identifying information.
How will you keep track of whether somebody's submitting 2 copies?
So that's something that we're working on right now, depending on which of the servers we end up using. But there's a couple of different ways that we can give them kind of an anonymous identifier at the beginning where we maybe have them do like, oh, sorry, I have a thumbs up going on. Like a middle initial and, the letter of the municipality that they're from or something along those lines where it creates kind of a key for them.
And will people be able to do part of it? If there's that kind of identifier, will they be able to pause in the middle and save their work and come back to it?
So theoretically, yes, you can start the survey, pause it, and then kind of come back and finish it. People we also recognize, which is just as is how surveys work, will likely start it and then say like, wow, this is kind of long, and then not finish it. So we are also expecting that. But yeah, we are hoping that it will be able to save their space. So if they want to start it, do it for 5 minutes and kind of come back to that, they can. Sorry, I'm going to stop sharing for 1 second just so that I can see you all.
Yeah, I mean, the length is kind of long. What's your strategy for advertising this, and are there any incentives for people to complete it?
So the Charles River Public Health District does not have any incentives for folks to complete this.
Yeah.
So we're hoping to lean into some of our like local partners. I know, for example, we've done one community engagement session in Needham, and we heard from a couple of folks that were really excited about what this data could also offer them. So for example, we met with folks from the library who were really excited to hear about this information on caregivers. And so I think that kind of gave them the excitement to then help us distribute the survey because we can eventually share the data with them. But the other piece is that we are trying to be strategic with how we ask the questions. So we do have a couple of short answer questions, a couple of multiple choice questions, and then some of the questions are also just kind of like rated. So we're hoping that some of them won't be very long. Our goal is that once we actually kind of, this is a draft, wrap up the survey, is that we can actually give folks an estimate of how long the survey will take them to complete, start to finish, so that they are very clear going in what that looks like.
And, what's the mix of simple questions and narrative responses? How are you going to handle the narrative responses? And then the other piece is how much, what fraction of the town do you think you have to collect to be statistically significant in reporting things back?
Yes, so we have been running some data on how much of the town we need to collect to get things back. We're going to go specific for each municipality on that and also try and make it demographically representative, right, for the gender, race, age, that sort of thing. I know that one of the things that comes up a lot that has happened previously in Needham is that we got kind of a skewed survey samples of mostly folks over 65 were filling out the survey and no one in between. And so we've been working really closely with a lot of like businesses to try and target that 18 to 40 demographic, getting creative of where we might find people, whether it be social media. We had some folks mention like nail salons tend to be a really good place to catch people.
We don't
And
have
so
a
we're-
lot of those here in Dover, though.
Okay. Well, we'll have to get creative then. I think I saw another hand up.
Yeah, I have a raft of questions, probably far
Okay.
beyond the amount of time that's
Okay.
allotted to this.
And I will
But
say I'm happy to take other questions via email whenever you guys are ready
yeah.
to cut me off.
Well, I am too concerned about the validity of this and your response that seemed to suggest that the validity would vary, at least in terms of responses, percentage wise by town. There wouldn't be an absolute validity in terms of number of responses per household, which troubles me a bit. Also troubling is the fact that it looks as though the same questions will be presented to the residents of all four towns, exact same questions. Well, these towns have unique characteristics and may deserve some different questions per town. I'm also concerned with anonymity a little bit. And when you mention gender and race, I think those are words that trouble some people if they are asked to respond in that regard. I'm also was given a heads up that you may be asking about income, which again, in this town, I think will bring a negative
Okay.
response in terms
Okay.
of people filling out the survey. And again, just to reiterate, people delineating their medical conditions, I would want to see in writing what you've done regarding HIPAA and preservation of privacy
Okay.
and those responses.
Well, for a lot of these, Steve, someone can just say they prefer not to answer too, right? Sex, gender, race.
Yeah, so I will follow up with that, John. Thank you. Is that every question has the ability to be skipped. So if at any point you don't want to answer a question, you don't have to. And we did include that throughout. So if you don't answer a question, it's not going to disqualify you from participating in the rest of the survey if somebody chose to, for example, leave the demographic section blank. But to your point, Stephen, I think that's really helpful information. I mean, you all know your communities best. And so if you think that those questions are going to be triggering or alarming for folks, that's really helpful for us to know in advance.
And it also may affect the validity
Okay.
if people opt not to answer certain questions. So I
Okay.
think you have to take that into account as well.
Okay. Thank you.
I have a question about demographics. Do you perceive that is it important for us to, in your mind, for us to have a certain percentage from each of the different age brackets? And if so, would you be capping the number of submissions if, let's say, the over 65 population was participating wildly in this, would you cap them, or would you be giving us feedback about trying harder to solicit participation from other age groups? And I would say it's hard for me to figure out a way that we would capture that 18 to 40-year-old population. I mean, you could get a number of people who are maybe 45 to 65 at the transfer station. But I don't know. I don't know where. I don't know. Our town doesn't have a lot. It doesn't have a lot going on socially for.
Yeah, thanks for that. And candidly, we haven't talked with Carrie or had a chat about capping. I don't think we have any intentions of capping the survey. I think the more participation, the better. We don't intend to say like, hey, over 65 crowd, you're too involved in your community. We don't want to hear from you. That I don't think that's our take at all. But we are hoping to say like, if we see at this midpoint, hey, we're not seeing enough representation from maybe the 30 to 40 group, then maybe we're trying to target those folks a little bit more. But I don't think we have any intentions to cap anybody from participating in the survey.
I mean, this would be a great opportunity for Sophia to develop a poster or a banner that we can put up downtown with a QR code.
Yeah, I know that some of the things we've talked about in some of the other municipalities were QR codes on their like sporting events areas and that sort of thing. We do also intend to have a couple of like little posters that we can give businesses to put the survey up. So yeah, we would love to help if there's anywhere that you think a poster would do well, John. I'm happy to chat about that.
Well, I mean, we put up banners at the townhouse, and that's one place that might make sense. I think posters in some of the local businesses, although, if you look, they're all really here in Dover. I don't know if you spent much time here, but all concentrated in the center of town. Getting this up in the library, I think, is going to be important. Yeah, hopefully the local businesses, as Kay mentioned, the transfer station is a place where a lot of people end up. And then, some kind of outreach potentially through the schools could be really useful too. But, the high school in particular is shared with Sherborne. And, I don't know if you're doing a survey in Sherborne or not. Okay.
Yeah.
Yeah. So, it may be important to target the schools too.
Although the age group is pretty, I mean, there aren't many over 18s there.
Well, it would be the parents,
Parents.
but
Oh, I see the
yeah,
parents.
yeah, the parents of the students, which would actually cover some of that younger demographic too that we were
Yes.
looking for.
Yeah. And so, I see some of them responding just because they're very interested in services too.
Yeah.
So if I may jump in, so Arissa, you're looking to finalize this by the end of the month. Is that what you said?
Correct.
Great. So I guess the plan from here, I know BME had set up the stakeholder meeting for the end of next week. So my plan would be to round up some stakeholders from Dover, see if they can come join us next Thursday to actually go over the survey in more detail. Iron out some of the questions and those types of things. Maybe between now and next Thursday, we can distribute this to my board just so they have an opportunity to maybe scratch out some things they don't like and that type of thing. Does that sound reasonable?
Sounds good to me.
Yeah.
We'd like to hear Arissa's response.
Yes, absolutely.
And would the stakeholder meeting be virtual?
Yes. Gail, were you going to add something?
Yeah, are the other communities planning to launch it at the end of April? I was in Needham this morning and this subject came up, and I think they're planning
Not Needham.
not need. So Needham's
Yeah.
going to do it at the start of the school year, I think, is what they
Yeah,
were aiming for.
I think they're still working on the final date. I guess, to summarize the story, there's another survey going out in Needham at the same time, essentially, I think
Right.
May 1st. And so we don't want to be asking the community to take two surveys at once. They
Right.
probably just won't do it, and it's another long survey. And
Right.
so I think we're planning to launch in Dover, Sherborne, and Medfield at the end of April, early May, and Needham will happen later.
Okay, thank you.
Yeah, of course.
Does anyone here wish to be part of the stakeholder group or have any requests for, anyone specific we should think about asking? I have a list in mind, but
I was curious if Gail had some thoughts about that since she does a lot of community outreach.
Gail has unfortunately probably heard me give this spiel 7 times at this point. But yes, Gail, please feel free to add anything.
I mean, we've talked about the usual suspects, if you will, the, library, the school, I would be interested in the school nurses in particular. There's some others I haven't really given a whole lot of thought to beyond the library, after school programs, Parks and Rec.
Yep.
Would be a great partner to have involved in this.
go ahead.
I would be interested in our Board of Health having an opportunity to render an opinion regarding the questions that are finalized in the survey.
That sounds great.
I'm not sure how you do that logistically, but I think I owe our constituency the right to see them and reflect with them before saying yay or no.
Absolutely. We have been sending out a like Word document of it. And then I am happy to accept the Word document back with kind of comments and edits. Or if you just want to email me the feedback, that's also totally fine. Or if you want to call me, email me, Zoom me, whatever that looks like, I'm happy to do that too. I'm happy to take feedback in whatever way is best for you all.
Well, it's basically my thought that the Board of Health might want to have a final cut on this, and as they say in the movie world, and not having that opportunity disquiets me some.
Yeah, absolutely.
I don't think anyone's saying we don't have that opportunity. I do think that we have to think about the logistics of that, so that
Mhm.
we're not violating the open meeting law um, I'm imagining that Arissa would send us a document and then we would each comment and then we would maybe funnel our comments back to Jason and Arissa to synthesize, because unless we're in a public meeting, we can't debate with each other, even by email, the pros and cons of one phrase in a question or whatever.
And if the deadline's the end of the month, it's running a little bit short.
Yeah. So what do you think about, I was just thinking aloud as I proposed that, but that we would each make our comments and submit them to Jason and Arissa. Does that make sense to the two of you? Gail also, Gail, are you pretty involved in this?
Yes, I'd be interested in seeing the feedback.
So maybe the three board members would submit their thoughts to the three of you, and then you would work on, whatever you wanted, whatever you thought made sense.
So, yeah, I think that makes sense. Aside from these logistics, I I don't want to keep you too long, Arissa, but I
Nope.
was curious, the end result of this is going to be a town by town report, a regional report, a set of recommendations. What's going to come out of it?
The end result will be a report that includes both a town by town breakdown and a regional breakdown.
And, the goal is to make recommendations for specific areas where we might want to consider providing additional support or where there are gaps.
So this document in particular will not necessarily focus on recommendations. This document is mostly just meant to be an assessment and saying kind of here's what's happening in each of our individual municipalities. Here's what's happening within our Charles River Public Health District shared services arrangement at large. And then theoretically, a next step would be a community health improvement plan, which is more of the recommendations piece to say, like, here are the things each of our individual communities need. Here are some spots where maybe we can overlap together as a shared services arrangement and try to make some adjustments to those things based on our strategic plan and kind of building that out.
Yeah, you're not here in Massachusetts, are you? It's very bright behind you.
I am in Chicago.
Okay. Yeah, part of the reason I'm asking is, one of the challenges here in Massachusetts is things vary so much town by town.
Absolutely. And I should also say, and Stephen, I apologize because I think you hinted at this earlier. One of the things that we kind of have at the bottom where it says your community is that's where we've plugged community specific questions. So very early on, I think we were talking to Sherborne and they said, listen, we've got septic questions and some environmental health questions that we really need to focus on. And we said, we're happy to answer those questions. And Needham said, well, those probably don't apply to us. So we added in an option at the bottom that will be community specific, because I think you've all really alluded to the fact that every town and municipality is so different that they all can't be the exact same, right? So we want to pick some alignment so that allows the shared services arrangement to kind of apply for grant opportunities and funding opportunities as a unit. But then we also recognize that each of your towns are so specific.
It might be useful to know what, Sherborne suggested too. And I don't know if that's been incorporated already, because
Yes.
we, like Sherborne, have wells and septic systems that distinguish us from Needham and some of the other surrounding towns.
Absolutely. Sorry, Gail, I don't know if you're going to say something. The Charles River Public Health District as a unit has seen the survey, I think, in multiple variations now, a couple of different times, and given lots of feedback and added lots of questions. Daryl, in particular, has spent a lot of time on this with us. And so most of what they have suggested is already included. There might be one or two tweaks that we're still kind of working on adding at this point. But I would say that a lot of what they have suggested is there. We also worked with a couple of different municipalities throughout Massachusetts to kind of gather their environmental health questions and see what people are asking and what kind of data they're gathering there to develop, particularly the environmental health section.
So you, just to clarify, then you will, the document that you send us will include any questions that are specific to any of the communities in the Charles River group,
Yes.
plus the ones that would be, plus the ones you're proposing would be applicable to each of us.
Yes.
Okay. I have another question to ask people about stakeholders. Do you think that public safety officials, that a representative of the public safety group would be useful to have in this? Just thinking that, you know, police and fire see a lot of what happens in this town. I don't know that they would have ideas about how to reach people. But I want to be sure that we try our best to include people you might call somewhat disenfranchised, you know, thinking about homebound people, people who are struggling in one way or another with life. And I don't have great ideas about how to reach them.
Maybe asking for an EMT from the fire department.
Asking for an EMT to
Have some input with this survey, you know, from what their experience has been responding to calls.
I prefer to be the chiefs at the chief level.
Why is that?
Yeah, the EMTs are, they're the ones directly interacting with people. Well, but yeah, what are your thoughts, Steve?
Well, I'm concerned about response times for, say, 911 calls. I'm concerned about cell phone coverage for emergencies in this town. Those are valid things that our fire people and police are aware of. I'm concerned about calls to homebound people. Never got very much good data on that.
But you think
In terms of their needs.
You think talking to the chief would be preferable to talking to one of the staff EMTs?
Well, the fire chief would probably be okay. He's been around long enough and is a volunteer fire person here, but and it's quite possible the police chief has now been around long enough to comment ably.
We have a great relationship with both, so I'm happy to ask either one.
Thanks, Jason.
They may
Any
have
last minute questions for Arissa before we let her go?
Was this worse than you expected?
No, not at all. Jason's one of my favorites, and he promised this would be fine. So it's all going well. And again, I want to be clear, like this isn't the end of the communication. I am happy to give everyone my email. I'm open to more conversations, emails, whatever works for you all.
Great. Arissa, if you could just send me the most up-to-date copy of the survey so I can just distribute that, and then we'll go from there and we'll get everything wrapped up by month's end.
Absolutely. All right.
Arissa, thank you very much.
Thank you so much.
Yes, of course. Nice to see you all. Sorry for keeping you so long. Have a nice
No
evening.
worries.
We kept you long, Krista, so thank you.
You did a great job summarizing very fast. So
Thanks.
understandable. Thank you.
See you all later.
Bye.
Sophia, if you want to let Rick Nagy in.
Yep, I'll send you an invite now.
All right, can you guys hear and see me?
Yes.
Yes, we can.
Great. Is my video frozen?
No, you're good.
Okay.
Nope. Rick, why don't we all introduce ourselves, beginning with you?
Sure.
Just-
Yeah, hi, I'm Rick. I grew up in Dover. I now live here. I'm a software engineer. And I'm on the Open Space Committee and the Land Management Working Group. Some of you may know my sister Anna Nagy, who's on Concom, whose reputation far outpaces anything I could ever do. And yeah, I have some questions and thoughts about COVID risk at the Carroll Community Center. We had a great email thread, and Kay offered for me to come to a meeting, and I thought I'd take her up on that.
So, I'm Kay. You and I have met before.
Of
And
course.
um, others, do you want to introduce yourselves? John?
Hi, Rick. Nice to meet you. My name is John Quackenbush. I've been a member of the Board of Health now, I think, for 6 years, or 7 years, something like that. No, maybe not that long. I've been on Board of Health for a while. And I'm a professor at the Harvard School of Public Health. So nice to meet you.
I remember when you ran during early COVID. That was very exciting.
Yes. Well, I'm glad I made a positive impression then.
Steve?
Steve Kruskal. I guess I'm a 3-term member at this point, plus number of years spent on the Lime Committee and allied with the Board of Health prior. So what do you got to say?
And Gail and Sophia? Want to introduce yourselves?
Hi, Rick. I'm Gail Varsa, the public health nurse for the communities of Dover and Sherburne.
And hi, I'm Sophia. Nice to meet you. I'm one of the admins in the Board of Health office.
And Rick, I'm assuming you know Jason.
I do. I was talking to Jason last week about a completely unrelated matter in person at the Board of Health.
Yeah, I hope I was helpful. I don't know what ended up happening with that.
So, okay, so long story short, you were very helpful. We just signed the purchase and sale on Friday for the house we were talking about.
Congratulations.
Thank you. And yeah, we're going to be back in June to figure out what to do with that that thing, the deed thing we were talking about. But yeah, no, I very, very much appreciate your input.
Of course. And thanks for hanging tight for a few minutes. I know our first presentation went a little long, so I appreciate you hanging in there.
Yeah. So, okay, so where this started is, I have another sister, her name is Elizabeth, and she has long COVID. She got long COVID. She first got COVID in December 2022, I think. Got obviously contracted long COVID, from that infection. And so to this day, her doctors are really she's recovered a lot. But still to this day, she's still, has a lot of issues with fatigue and various other symptoms. She's partially homebound. And her doctors are really insistent that she be careful about COVID reinfection. As a result, since I live with her, I'm very careful about COVID reinfection. And we have a complex protocol for how we measure reinfection risk and manage our risk budget amongst each other. We use CO2 as a proxy for far field risk, and we try to measure the amount of time that we're talking face to face to people. And I can go through the whole protocol. We have a pretty thorough. We tried to do our best to take the literature and extrapolate out to like the most specific framework we can come up with that's better than the sort of standard 6 feet guidance. And in doing so, I've learned a lot about respiratory spread, and I've honestly become quite interested in it myself. But so where this started was I'm also on the board of the DLCT, and we periodically do our meetings at the Carroll Community Center now. And when we were there in December, I measured on my CO2 meter that after like 15 minutes into the meeting, the CO2 in that room was something like 1,200 parts per million, which is not crazy high, but is like, not great, is not enough that sitting in a meeting for 2 hours at 1,200 parts per million, talking face to face across a table from people, like that is a reasonable spread event. And so I guess my question is there anything we can do to try to reduce the risk of, COVID and other diseases in these public spaces? Carroll Community Center is, I think, probably the most interesting one to look at because it's new and the HVAC system is new. I think the townhouse obviously is interesting as well, since there's a lot of staff that works there and would benefit. And in the long run, if we end up redoing any of the systems, so I don't know. I don't really have a like specific request for you. I'm just more interested. What do you all think about this? And do you have opinions on how we should be measuring risk in these scenarios?
Do you have a sense we're not getting enough air exchanges in the community center?
Yeah, I mean,
Or
the short answer is the air's not turning over enough. Like
yeah,
at that rate, the risk is building pretty quickly. And if someone in that room had COVID, a couple hours in there, you're probably going to get it.
If that is a valid measurement,
Mhm.
and I would hope that measurements would be taken in various parts of the Carroll Center and the town hall and our public buildings.
Mhm.
But 1,200 would be unacceptable, and there should be some action taken.
yeah. And if this is a brand new building, it should have been really well designed to provide that level or
Should be
sufficient
below
level of,
800 in a
yeah.
building like that.
Oh, yeah.
But
So I should say, I said this to Kay. Kay did a deep dive on the literature, and I don't want to summarize what you said, but came to somewhat different conclusions.
yeah, and my conclusion is that well, let me back up and say that ASHRAE, the American Society for Air Conditioning, the HVAC, I can't remember what the acronym stands for.
Something like that.
Uh,
Mhm.
they have a specific position paper on this, on minimizing risk, and with a section about CO2 measurement, and they state that there are too many confounding factors
Yeah.
to enable people who manage buildings to make decisions based on CO2 levels. And it does, yes, it sounds bad, but the question is there aren't enough data to say, well, with a level of X, the following intervention should be made.
Yeah.
And I think it would be very difficult to argue that Dover should buck the ASHRAE recommendation, the guidance about how to manage building ventilation, which doesn't mean that we can't do things like have individual ventilation units in rooms, which we do to some extent. I don't know about in the Carroll Center, but certainly in the townhouse, there are a lot of those
Mhm.
around. We can open windows. I think it's it's hard to it's hard for me to think of other strategies for dealing with this.
Well, there are a couple pieces, right? One is just how many building air exchanges you have, and I don't know what the code says. Also, it'd be interesting to know, and again, I would have thought this would have been addressed sufficiently. Do they have HEPA filters? Do they have all the other things that, have been recommended as systems for purifying the air? Because you may not get the exchanges, but if you're filtering viruses out of the air through the HVAC system, yeah, you're right, Kay. The CO2 levels may not actually reflect the the overall air quality or other aspects of air quality.
I did 15 minutes of AI search in this. Not enough, certainly, but it seems pretty clear that carbon dioxide high levels are used as a pretty good indicator for the amount of air exchange there is in and risk. Uh,
Used by whom? Is a good
the general public and decision makers. I don't know if they act on them. Certainly a HEPA filter isn't going to do anything about carbon dioxide.
So
It just takes care of
I
particulate
think
stuff.
the issue is that there are so many factors that influence infection transmission. Filtration, air turnover, carbon dioxide, number of people in a room,
Humidity,
what?
humidity, probably
Humidity.
too. Yeah.
I think
Also, what you're doing is a big one because like singing or like running in a gym is like orders of magnitude worse
Yeah.
than like quietly breathing.
Yeah.
And what I said to Rick in an email I wrote to him is that I said it in other words, but I don't the Board of Health can't recommend that the town get out ahead of the major professional society that makes recommendations and is paid attention to around the world. I mean, they're very thoughtful, evidence-based organization, and they advise against using CO2 levels as a proxy for infectivity. That doesn't mean they're saying don't pay attention to filtration and air turnover and so forth, but that it's not a metric that anyone really knows how to deal with,
Yeah.
independent of the other kinds of things that we do pay attention to. And I wonder if we should ask, I guess it would be Carl Warnick to talk with us about what's about what the HVAC system does in the Carroll Center. I don't know if
Yeah, I
Just-
think that's reasonable.
just somehow Barry Goldman's name is coming to my head as somebody who might know more about this. John, you weren't involved in the
No,
Carroll
I think Barry
Sure.
knows a fair bit, but I'm not sure he has all the deep knowledge of what the HVAC system is doing.
Yeah, and Carl would be the best person.
We did visit this during COVID.
Yes,
And we're sure that we were within acceptable standards of air exchange.
except the new building wasn't completed.
Right, right.
Yeah.
I understand. Yeah.
And what they did is they worked on retrofitting the old building, putting in some mini splits,
Yeah,
I think,
yeah.
and working on filters, and then adding some of the
Yeah.
little filtration devices in
The
the
portable units,
portable units.
portable HEPA filters, yeah.
I think that the townhouse is obviously a worse situation. And there is a project, there is talk now, isn't there, about John, do you think that is the capital budget committee involved in a proposal to bring in a consultancy to look at a revision to the HVAC system in that building, and possibly I've heard about ground source heat pump and
Yeah.
doing the whole thing.
Yes, there's
Yeah.
there's a lot of talk
Something-
about improving the heating and cooling systems in the building, but I don't know if anybody has actually really thought about air filtration, air exchanges.
Mhm.
And I don't know what the Massachusetts state regulations are. I mean, I don't know if Jason has any insight into that.
Very little insight on it, to be honest with you.
So my understanding is that this is one of the things I've learned in this is that, yeah, Kay's 100% right that obviously that yeah, there's no consensus opinion on this. And so, well, the consensus opinion right now is we can't use this as a proxy. And I'm not proposing right now that like, oh, we should break that. What I also understand though is that essentially there's no unified framework yet around handling respiratory risk in HVAC systems. There's sort of like the traditional stuff that we've had for a really long time, and then honestly there's a lot of research post COVID that is only now just really like bearing fruit. And it has, and so ASHRAE's position paper was essentially like, yeah, we need to do a lot of research because there's a lot of confounding variables, the activities of the people in the room, the humidity level, blah blah blah. Um, I can say that being said, like if you read the papers, it's pretty clear that what's going on is like CO2 um is a essentially a tracer gas for exhalation. If you combine that with the activity that the people are doing and the community spread and the humidity, you can get a pretty good sense of how many the of per minute you spend in that room, how the risk level um, of getting a respiratory disease. And like based on those things, like yeah, like the more respiratory air, the gas in the room, the more likely you are to get it, and CO2 is kind of a good proxy for that. So I mean, I don't know, like I'm not saying that oh we've got to ventilate the Carroll Community Center to 800 parts per million 100% of the time and that that'll solve the problem. At the same time, I can say that like I'm pretty sure that the current situation is riskier than at least given my family's health situation than I love. So I don't know, like I don't know if the answer is just wait 5 years until the research catches up, or if there's something else to do in the meantime. But yeah, I think this is a interesting area.
Well, I think it would behoove us to at least see if the Carroll Center HVAC system is performing to spec.
Mm,
hmm I would agree.
that's a great idea.
I think that makes sense. And it wouldn't hurt to review where we are with the townhouse as well, and whether the recommendations that were made by the consultant firm back during COVID are being followed.
I will say, Jason, when I went in to speak with you, I guess it was 2 days ago, 2 weeks ago, I did bring a CO2 monitor with me, and it did hit 1500 when I was in the room with you.
La-di-da.
Yeah.
And that could have just been my hot breathing all over you. I guess we'll never know.
No, one person is enough for that.
He was
Yeah.
running though.
I happen to be attending a DLCT board meeting next week or the week after, one of the two. I can take CO2 readings at that. That would be interesting. See what how the system is performing for that. I can report back to you guys how that goes.
Yeah, please do. Actually, that would be great. It'd be nice to have a little bit of a sample size.
But,
Yeah.
well, we could have Carl perhaps orchestrate a check of the systems.
That sounds more scientific.
Jason, do you want to speak to Carl about this? And
Yeah, absolutely. I definitely think we have some due diligence we can do on this.
yeah,
It's the very least we can do for Rick and for Rick's family.
Yeah.
I think we owe it to them and to the townspeople as well. Definitely need to explore this to some extent and see what we can figure out.
I'll say I appreciate it for my family. I think of it more as like there's a lot of elderly people that are using the community center. Um, there's a lot of I don't like it's a public space that a lot of people who may be at risk are using. I'm lucky enough that I can spend the time to research this stuff and learn about it and protect myself. But hopefully we can have a baseline that's good. I think one of the things is that the overall system may be performing in one way, but like handling a meeting upstairs in that small conference room is a different matter. I'd be interested in how the gym is doing, by the way. I don't know if the system is up for that or the when they're like large public meetings in the public meeting room, whether it's keeping up with like a large group breathing in that room.
Well, it sounds like we have some homework to do.
yeah.
It might be good to have Carl come and talk to us a little bit, try to get a little more data and information. And, maybe have a chance to talk to you again, Rick, and share what we've learned.
Yeah, please. If you have it on the agenda, let me know. I'd love to come back.
It might be interesting for all of us to speak to Carl together.
Yeah.
I'd love to be there if that's possible.
For what it's worth, we did have a pretty benign flu and COVID season this winter over. Would you agree, Gail?
Yes.
Fortunately.
I believe that was the trend across the Boston area. You can see that in the wastewater, that compared to prior years, it was low. And right now, regionally, we are really low. I've been paying attention, which is good.
I mean,
Although
I
I
think
got COVID a few weeks ago.
I mean that there is the the prevalence of disease
Mhm.
in the community is another important factor. And if you're really trying to minimize your risk, it's that's when thinking about avoiding large meetings and wearing a mask begins to be important, no matter what's happening
Yeah,
to building HVAC systems. But it's just another measure to add. You have many we have many different ways we can try to address this, but I really think having Carl come in would be very helpful.
yeah, the model that we built for measuring risk includes you plug in the community wastewater data and it estimates like the chance that any given person in that room is spreading COVID.
Mhm.
It's pretty cool.
All right. Any more questions that anyone has or comments? Rick, thanks for coming. It's interesting to talk to you. You're very thoughtful about this.
Yeah, I appreciate it. Look, as far as I'm concerned, part of the reason I'm interested in this is that I just like reading this research and then looking outside, like it feels like I feel like it's like we're just at the beginning of, filtering water or something like that. Like we're all used
Yeah.
to like contaminated water. Like I'm confident over the next couple decades we'll reach the point that people are breathing fresh air essentially all the time. And I don't know, I'm kind of thinking like, start close to home and then, see what happens.
Good. Well, thank you.
Thank you, Rick. We'll stay in touch. We'll work on this together.
Awesome. Thanks, guys.
Okay.
Take care, Rick.
Have a good night.
Sure.
So, shall we go back to Jason? You'll talk with Carl, and then
Yes. Yep. Have it in my notes here.
all right, good. So let's go back to our minutes. Excuse me. Does anyone have any changes and have any changes to suggest to the minutes? If not, then would someone like to move that we accept them?
I move that we accept the minutes as written.
The minutes of February 2nd.
Yes, thank you.
2
Second.
months. All in favor, aye, Kay Peterson.
Hi, John Quackenbush.
Hi, Stephen Kruskal.
Great. Okay, and let's move on to Gail.
Sophia, can you bring up the flu report for Dover? So just the data that I ran, I sat down with the epidemiologists in Needham today just to look at the fourth quarter of 2025 and the first quarter of 2026 for confirmed flu cases in Dover. And it's broken down by age group. So when you take a look at this Excel, it's interesting what you'll see. So these are all the cases. These are the details here. So average age in 2025 for getting flu was 16 years old. Average age in 2026, 22 years old. Informally, that coincides with some of the vaccination data that I see in MIIS. It's not perfect, but the population that does not pursue flu vaccines are the 18 to 45-year-olds. And again, these numbers are low because it's just confirmed cases. I didn't include suspect. It does not include all the cases that test at home. But I thought the age distribution was pretty interesting to look at. And it's not the whole flu season. Technically, the flu season goes from June year over year. So I just took the fourth quarter of 2025 and the first of 2026. But, we escaped relatively unscathed. We did not have a lot of flu.
It's astonishing how few seniors, how
Yes.
a few adults are in this group.
The over 65 are highly vaccinated.
Yeah.
The younger populations, maybe not so much.
It's astonishing.
Yeah.
You reported the average, that's the mean, I take it. Did you happen to calculate the median? If not, that's fine.
No.
Okay.
Are the schools gathering data on the percentages of students that are vaccinated against flu?
I don't know. I don't know about that. Obviously, they track the data for what's required for entry into school, but I'm not sure about flu.
Be curious to know.
Yeah, I'll find out.
You know, it's interesting. I know a lot of parents with young kids who ended up getting whacked with flu this year.
Right.
And do you have similar numbers for COVID or no?
I did not look at COVID. The numbers were really small, and anything less than 5 is considered not significant for reporting.
Yeah, I was just curious because this new cicada strain, they're saying, has a much higher infectivity rate in young people relative to older people.
Yeah.
But still, there's no confidence in that the current vaccine covers it.
Right.
Exactly.
So remember the flu kits, flu and COVID kits, the test kits that you talked about at our last meeting. Did anybody end up getting those from us?
I think we gave one out to an employee and maybe 1 or 2 to residents. That's it.
There probably would have been more requests for them if there'd been more COVID around.
Yeah. Yeah. The other update I just wanted to touch quickly on is the public health emergency preparedness plan that Jason and I have been participating with public safety. We went to a training last week, which was much smaller than the one we were at in January. It was specifically for towns that need support with a shelter plan. So both our chiefs were there, Jason and I, and Janet Claypool, to talk about shelter planning in an emergency situation. So I was there's been tremendous support from the town and engagement on this. And the fire chief in particular has been really helpful with putting together checklists. Our trailer for the Board of Health moved over to the fire station, and we're in the process of cleaning that out, getting new supplies and getting that up to date. So remarkably, when he looked in it, it was very clean. There weren't there's old stuff in there that we're going to get rid of, but I was worried about rodents or anything else that might be there, but it was looking pretty good.
As I recall, Linda spent a good deal of time tidying it up.
She did at one point, yeah. So.
And the Sherburne people participated in this program as well, right?
Yes. Yeah.
Great.
That's it for me.
Well, thank you. Any questions?
Thank you, Gil.
Yeah, thank you. And thanks for doing the rabies clinic too.
Well,
All right.
John, since you've raised it, Jason, could you report on attendees on our rabies clinic?
Yeah, of course. So we ended up with 13 animals total, 8 dogs, 5 cats. And this is compared to the 22 we had last year, and 14 the year prior. So I said to Steve earlier, I'm kind of starting to question a little bit if it's worth continuing to do this, just because a lot of time, effort, and money goes into it. To get such a not so great turnout. So I'm curious to hear from the board if anyone has any thoughts on that going forward.
I was surprised by the small numbers, and I didn't know what the trend looked like, but it does sound like it might not make a whole lot of sense.
My only concern would be about people who would rely on it next year. But it doesn't sound like, from what you said earlier, Jason, that it doesn't sound as if we have repeat customers. It's kind of a random assortment of people each time. Steve?
So I commented on this to Jason this morning, but two thoughts. One is I don't think a single data point is enough to make a decision on to discontinue it, in as much as the service that we've offered the town for many years. And the town has been very gracious in providing us funds to increase our staffing over the last few years. I think that anything we can offer them that can be viewed as positive is something we should continue. So I wouldn't want to disband it next year.
Maybe give it one more year and see.
Yeah. Yeah.
I mean, it's not a single data point, Steve. It's 3 years of not that many people.
Well, the year before was okay.
Um,
I'm sorry, can I ask for the numbers again for the past 3 years?
So 13 this year, 22 last year, and 14 the year before. And if you want to go even further out, my first year we had 8.
Yeah, so I mean, even 22, it's small numbers, thinking about the number of pets in town, right? We have 2 cats, and I don't know if you brought your cat, Steve, but
No, he already had his shots. He's up to date.
exactly. I think most people end up getting this at the veterinarian.
I mean, we could send a questionnaire to the people who've used the service in the past and ask them where they're getting their rabies vaccinations these days, and do they see it as a positive for the Board of Health to continue to offer this service?
Yeah, I mean, I tend to agree with Steve. I think if this is an easy thing that we can do and offer, why not just keep doing it? I mean, I will say the people who do show up are very appreciative. So even just, if this is an opportunity for us to be out in the community,
Yep.
Showing face, meeting people, making a difference, even if it is a small difference. I mean, if it's going to cost us all in $1,000, that's worth it to me.
Yeah, you're right.
All right.
Get Sophia out there.
Are there any marketing changes you would make going forward?
I mean, one thought I do have is maybe instead of doing 2 hours, we make it more condensed, make it just a 1 hour block. So, I don't know, maybe just making it a little bit more efficient that way.
Mm-hmm. When does Felicia send out the license notifications? When does that happen?
I think sometime
For the
in March,
census.
I'm gonna say.
Goes with the census, and when is that? Is winter or early winter? I can't remember.
Usually around February, early February, isn't it?
What if we were to put a notice in that envelope along with the notification about the the applications for licensing to
Yeah,
publicize it.
it's a good thought.
Why don't we try to remember that next year? All right. Anything else on that topic? So, shall we move on to talk about opioid funds?
Yes, everyone's favorite topic. So I wanted to spend a couple minutes on this. This is something that's been on my list pretty much the entire 4 years I've been here. So kind of got back into some of this the last few months. Just to kind of recap. So opioid funds, they can be used on substance use prevention, harm reduction, treatment and recovery. Each town is allotted, each town in Massachusetts, that is, has been allocated X amount of dollars based on population and other factors. So Dover, since the inception of this program, has received about $75,000. That, as far as I know, are just living in one of the town accounts. We will continue to receive funds through 2039. And the end total will be somewhere in the ballpark of $250,000. So I met with town administrator a few weeks back. This was one of our topics of discussion. The gist I got with him, and Kay, feel free to jump in. This was the meeting you and I had with Mike. The selectmen, as far as I know, are the holder of the funds. In order to spend the funds, they would appoint a committee just to kind of meet, go over some possible opportunities, as far as spending these goes. Committee would decide, and then it would be brought to town meeting to be.
No.
Go ahead, Kay.
Town meeting was something that was required initially, but it's no longer required.
Okay. Go ahead, Steve.
I may be dead wrong in this, but it was my understanding that the opioid funds were to be administered by local boards of health.
See, that was my understanding as well, but my takeaway from this interaction is that in our case, it's the Board of Selectmen.
Well, I
really
wish
know.
we could.
I don't have a good answer for that.
I wish we could ascertain that. Not that we wouldn't defer to the town in some ways regarding the administration. I just want to be assured that there's a paper trail for this, and our town doesn't wind up on the front page of the Globe regarding the money.
Right.
Mhm.
I kind of got the sense that it wasn't going to be easy for us to spend the funds. So that kind of turned me off a little bit.
Yeah. No, I understand that we don't have a great zest for dealing with this. I just want to make sure that, given the history in the town in the past of certain events that have occurred, that
Yeah.
this is being followed according to the law.
Anybody have any other thoughts or questions as we kind of navigate that whole thing?
So, what do we have any idea what some of the other towns are using the money for? Because I could think of, education programs we could support at the school, maybe, I don't know. I'm trying to figure out good ways that we might be able to make use of this sort of funding.
And what is this spectrum that we can use the money for? Because is it coming to prevent smoking issues or vaping issues, or
No,
or is it very narrow in definition?
it's narrow. It's directed at opioid use
Yeah.
prevention and mitigation.
Right, because Jason said addiction, and so you could think of that being pretty broadly construed.
Yeah.
Ideally, other towns have used it also for people impacted, families, residents, those in recovery. And Jason and I have connected recently with recovery coach in Needham and substance abuse coordinator just to get a broader picture, resources and ideas for Dover too.
There are towns that pool their resources. They're
Right.
funded from the opioid payouts. That's another option.
And a lot of towns, to your question, John, a lot of towns end up partnering with different programs, like recovery programs and housing type things, where people can go. So there's plenty of options out there. It's just a matter of figuring out what would be best for us.
So, yeah, do you have any sense if since we have, the shared services agreement, and probably most towns have small pots of money, if there would be some interest in create, and again, the selectmen probably have to weigh in on this, but that maybe there could be some shared services between the towns. That might be a way of getting enough funds you could actually do something, right? I love your idea about trying to help people in recovery. Maybe there are a lot of things that you could use this money for.
Yeah, that's a great thought. Shared services and pooling the money, definitely an option for us.
Yeah.
Again, if the niceties of this law exclude the administration by boards of health, we don't have to pursue this very far. But if the mandate is for boards of health to decide how the money is distributed, that's a different story.
So why don't we plan to talk about some of these questions more at our next meeting? Do some research in the meantime.
Yeah.
Sounds good.
Shall we move on? Jason, animal inspector nominations on the agenda next.
Yeah, so just to go over this quickly, so we nominate an animal inspector annually. Papers are due by April 1st. As far as sending to the state goes. So obviously we are past April 1st. So what I did was I sent in our papers about a month ago for Jen Cronin, our existing animal inspector. And something I did different this year was I also submitted papers for myself to serve as the backup inspector, just in case we ever run into an issue where maybe Jen is away or unavailable. That at least gives me the ability to issue quarantine orders or any emergency type things I may have to do. So I just wanted to make sure we were covered for that. So what I'm looking for from you guys, I'm just hoping to ratify those nominations for both myself and Jen, just so we can have that officially on the books.
So I move we ratify the nominations of Jason and Jen as animal inspectors.
Is there a second? Steve, are you seconding?
No.
I'll second that then. All in favor?
I, John Quackenbush.
I, Kay Peterson.
Stephen Kruskal abstain.
Okay. Anything else to say about that, or shall we move on?
Nope, should be good. Thank you.
Okay. The warrant article about the associate board member.
Yep. Steve, you had asked to discuss this, so
I just want to bring it up for reconsideration.
And what do you want to bring up for reconsideration? What
The
aspect?
article, I'd like a second vote in case anyone's changed their mind. And
You mean about having an article at all, or about the wording of the article, what
Just-
specific?
I, as you probably know, voted no. And I continue to feel in that fashion. And we'll see how it goes, but I'd like a second vote on the part of the committee regarding it. With the names of the people voting yes and no.
Do you want to propose make a motion then?
Now make a motion for reconsideration of the vote.
But we've had more than one vote about this, so you need to be specific about what the vote would be.
And it's already
Maybe-
part of the public record, so, I mean, our votes are recorded.
Yeah, but you can always have a reconsideration of a vote at any time.
But you need to tell us exactly what you want reconsidered.
I think it's the way we're doing it is wrong.
Is there something in particular you would change?
Yes, I don't think that, I think we should have a unanimous vote on an associate member.
So then,
But evidently the vote did not go my way the last time. I just want people on the record yet again.
a second time, okay.
Well, I don't think you're presenting anything new, so I don't think this is something we should reconsider.
Okay, well, if that's the way it goes, it'll also be in the record.
Yeah. Well, there's no.
I'm
Go ahead, Kay.
I'm not certain about this, but can a member of a board make a motion? I'm assuming a member of the board can make a motion about anything at any time, right?
Yes.
And if you'd like to make a motion, Steve, and have it be formal, that way you feel free.
I just said I did, but
Okay.
You haven't said I move. You need to,
I move to reconsider the vote regarding an associate member.
is there a second?
No.
No second, so we will not reconsider. Okay. Let's move on to pool regulations. Unless there's more to say about the warrant article. Okay, Jason, do you want to discuss pools?
Actually, if you don't mind, Kay, I'll let you intro. This is your topic.
Um, Jason, remind me what prompted us to get into this. I've forgotten. There was a
So-
recent,
Yeah, so planning board is looking
Okay.
at updating some of their is it their bylaws or their regulations?
yeah, so thank you for jogging my memory. So the planning board is redoing its site plan bylaw, and they're trying to simplify. They have found that they think that the section on swimming pools that they have is something they'd like to just delete altogether from the site plan review process. There's one component of it that is relevant to us, and that is that they've had a regulation or bylaw that requires that people who are filling their pools do so with water from an external source. That is, that they not use their well or their hookup to a public water supply to fill their pools. So they would like us to add that to our pool regulation if we're in agreement. So Jason and I talked about this, and he was reviewing our regulations and decided to go ahead and think about updating all of our pool regs, as well as adding something about filling of pools. So as a consequence, he's made a number of changes. I think the only substantive one, Jason, is about the filling of pools. Is that right? Everything else is fairly minor. the editing you've done?
Yeah, I mean, our pool reg hasn't been updated in 30 years, so it just needed a lot of housekeeping type updates. It's a very short regulation. I've already gone through and done all my suggested edits. I only didn't share it with you guys because I had just shared the well regulation and I didn't want to throw too many things at you all at once. But I do have a draft ready to go for when we want to dive into that more and revisit. But like Kay said, what kind of drove this is that piece about the filling of the pools with well water. As we all know, water is a very touchy thing in town. So I think anything we can do to protect our water, protect our aquifers, we should definitely take the opportunity and do that. So, I mean, to me, that's a no-brainer. And in addition to that, look at any other areas that we can tighten up in our reg.
So if the other board members are in agreement that we should be adding something regulating the filling of pools, then Jason could go ahead and send his draft to all of us, and we could look at it and with the idea that unless there's something that is going to hang us up, that we would plan a hearing at our next meeting in May and pass that regulation at the time after a hearing. Are you all on board with the idea of adding something about filling of pools?
Yes.
I think that makes sense.
Okay. So Jason, you'll send us that, and then we can, if anyone has any serious objection, you can let Jason know, and then we could, if the worst comes to worst, we could just wait a month to hold a hearing until after we've discussed it more at our next meeting. But I suspect there won't be anything earth-shattering in this.
I will say, Kay, in my opinion, May's probably too soon just because we all need a chance to review it. Town council will have to review it. We'll have to do our postings. So to be safe, if this is something we want to do, maybe we look at our June meeting.
Okay. Sounds good. Okay, any other questions about that? All right, let's move on then. In our old business section on the agenda, we have emergency preparedness, but I think Gail's already spoken about that. Is that correct? There's nothing else to add.
Correct.
40B updates. There are 2 active 40B projects in town, right? The Trout Brook multi-site 40B, and there's been no news about that I've heard recently. And the Strawberry Hill 40B, where the application, the site review by what's the housing agency called? Mass Housing. They approved the site for consideration of a 40B. They do an initial approval following a preliminary application and a site walk. And so they found the site suitable for further investigation. And the next step would be for the developer to submit a comprehensive permit application to the Zoning Board of Appeals, which has not happened yet. Anything to add to that, Jason?
No, I mean, the 40B updates are really that there are no 40B updates at this point.
Yeah. And you all know that the planning board, or I don't know if it's planning board or ZBA, has created a website that allows people to track what's going on with 40B applications now. It's reasonably helpful. Not that there's much news, but
Is it NIMBY.com?
The last old business item is medical director. Jason, you want to summarize that?
Yeah, so as the group knows, we've been working with shared services to hire a shared medical director for all 4 communities. My understanding is there really hasn't been much in the way of progress on that. And I guess without giving too much away, I don't want to mention the person's name specifically, but we were approached by a resident who expressed interest in possibly being our medical director. So that's something that I'd like to explore. Sit down and meet with the person and just kind of gauge their interest, see if they may be a potential fit for us. So that is something we are going to pursue.
That's exciting.
The interested person came to blood pressure clinic, and it was a conversation. So you know me, I'm out there soliciting and marketing anyway.
You're doing our outreach, Gail.
Yeah.
And I have 2 other items if I may, Kay, if we're
Go
done
ahead.
with the medical director. So I've been working with some of the shared services folks to organize tobacco compliance checks. That's something we'd like to do in the very near future. The way that works is we basically coordinate with an officer and a student to conduct the check. And I guess from there it's either the store passes the check or they fail the check, and we decide kind of how to handle that, where to go from there. To my knowledge, it's not something that's ever been done in our community before, so it's kind of a new thing for all of us. I just kind of wanted to get a feel from you guys, just kind of what your thoughts were on that, just general feelings, I guess.
My knowledge, this has been administered at the state level where they brought people in certain age to check on our tobacco suppliers. That's already been done in the last 5 or 10 years, at least once.
What agency of the state does that? Do you know, Steve?
No, I don't. But I do remember hearing discussion about that.
How did it go? Do you remember? Did you hear that?
Yeah, I don't recall well enough to relate anything that would be accurate.
Well, if it hasn't been done in a while, it seems like it's reasonable to update the information.
Yeah, I
right?
think it's a great idea every so often to do that,
Yeah.
especially in this town.
And the cost would be covered by shared services, Jason?
I think we'd have to chip in a little bit, but it would really just be to get a gift card for the student type of thing. Like it wouldn't be anything substantial.
Yeah, great.
But yeah, I think it's important. That's our only way of knowing, right? We have to check it somehow. So
Yeah, I'm in favor of it also.
You do have to do a query on the student, I think, that you would select to do this.
yeah, I can definitely check on that. It'll be someone through the shared services, so we'll have to make sure all our ducks in a row for that. And the other item I had was I know we had talked about it a lot, kind of building up to this in offline, but wasn't actually on our agenda. Well regulations. So I shared a copy of that with all you guys. I also sent out a letter to realtors and well drillers that do work in town just to try and solicit feedback. So my plan is to kind of gather all that feedback from you guys, from these other stakeholders, and come to our next meeting with our most up-to-date, best version, and we can go from there.
Your thought is we would discuss these at the next meeting.
Correct.
Not-
Once
not-
we have like a more up-to-date, ready to go version.
Yeah. Do you think there's any reason that any realtors would want to come to the meeting? Do you think we should invite them, or do you think there's any point to that? You've already talked to one or two, right?
Yeah, and actually, what's funny, so one of the realtors that responded to us with feedback, they were already changes I had incorporated into the regulation. So it was kind of nice to get that reassurance, just kind of knowing that we're on the same page with some of those guys.
Mhm. Was this about PFAS or other aspects of the regulations?
So actually, it was about our well testing and who's responsible for it.
Mhm.
Because our well reg doesn't specify who does it, buyer or seller. So rather than play that guessing game, I mean, I think we're probably all in agreement. If you're getting ready for a home sale, it should be the seller's responsibility.
Yes.
So why not just have it say seller?
Yep. Good. Did you get any blowback about PFAS testing?
I did not.
Okay.
But in the last year or so, I've heard from realtors who have asked about us requiring it.
They've asked, but not complained about the idea.
No, they've basically just said, when are you guys going to add PFAS to the testing requirements?
Good.
And it sounds like, given the discussions we've had, that would be quite a useful thing to do at this point.
Good.
Any other old business or anything?
Nothing for me.
Not for me. Steve
No, not at this moment.
and Gail? All set?
I'm all set. Thank you.
Okay. I'll entertain a motion for adjournment.
I move that we adjourn.
Second.
All in favor? Aye, Kay Peterson.
Hi, John Quackenbush.
Hi, Stephen Kruskow.
All right. Good night, everybody.
Good
Thank
night.
you.
Good luck
Thank
with your
you.
glasses, Steve.
Thank you. Appreciate it.
Cat.
Hopefully they come together.
Steve, is it a Siamese cat?
No, it's a American Alley. Actually, it was feral.
Oh, really?
Yeah.
From Dover?
From the Medfield Animal Shelter. They
Oh,
were
wow.
very gracious and quite efficient and quite open about the history. I appreciated them
They're good there.
markedly.
You should have them join the Board of Health. We're all feral, so we'll fit right in.
Good luck with your cat, Steve.
Thanks.
All
Appreciate it.
right.
Bye.
Take
Bye,
Bye,
guys. Thank
Gail.
you.
Bye,
Nice work.
Jason. Bye, Sophia.